And welcome back. Well, many people wear long pants in the summer simply because they're embarrassed to show their legs. They don't seek treatment because they think it's just a cosmetic problem, but actually it could be something much worse. Dr. James Garidi is here with Vein Clinics of America, where they specialize exclusively in vein disease. Welcome back to the show.
Thank you very much.
I think this is such a timely topic for people because we're just starting to think, oh, we're going to get those shorts out or culottes, whatever it is that you put on during the summer. And a lot of people don't, simply because they're embarrassed of their legs. So let's kind of start by breaking down what vein disease is for people who have heard about it but not sure if it applies to them.
Sure, yeah, and it's interesting you mentioned the summer. Again, the flowers and the steak just really makes me think of being outside. And so many people, I think, are thinking the same thing. Hopefully the weather cooperates. But as people look at going outside, they do start to look at their legs, they look at their shorts, they look at whatever clothing they feel they can tolerate. And a lot of people, unfortunately, feel like they can't tolerate some of the stuff they used to wear. And veins are oftentimes a big part of that. Veins are basically stretched tubes that are carrying blood, and if they get big enough, they can be unsightly. People are always worried about that cosmetic component, but that extra blood sitting there causes pressure, and it can cause irritation, it can cause heaviness, discomfort, swelling, restless sensations, cramping at night. So there are a lot of symptoms that people feel related to those veins as well.
Yeah, and some of those things stop people from doing everyday activities. Maybe it's gardening, maybe it's getting out for that walk that you used to do with your neighbors because your legs, like you said, just feel too heavy, or they ache, or they're itchy or uncomfortable. What are some of the reasons that it's caused? Is it genetic? Is it because we cross our legs too much or wear heels? I mean, are those things true, or are they sort of rumored problems?
Yeah, that stuff is mostly rumor.
Okay.
They've looked at it over and over again. And
it's good to know.
Cross your legs away. Yeah, absolutely.
Good,
yeah,
all right.
Absolutely. It's genetic. The elastic within the vein wall isn't built right, and the elastic just gives out. So you put it under normal pressure, and the vein just stretches.
Okay. So what are some of the differences between the varicose veins and spider veins? Because spider can be cosmetic, right?
Yeah, and they can both be cosmetic. I always tell people it's kind of like a broken leg. It looks ugly, but it really hurts, right? So there's a cosmetic component and a medical component. It's the same thing for varicose veins, and it's the same thing for spider veins. So a lot of times people will look at spider veins and think that they're just cosmetic, and there's absolutely a cosmetic component, but there's also a medical component. There's a symptom component as well. The tricky part about the medical component is the symptoms are generic, they're vague. You know, my legs are achy and tired at the end of the day, I have some swelling, and people will also often look at those symptoms and think that they're related to something else. Well, I have swelling because I ate too much salt, or yeah, I have some cramps at night because I'm not taking enough potassium, or yeah, my legs are achy and tired because I'm getting older, or you know, I have arthritis or something. And sometimes those things are the case as well, but a lot of times it's the veins that are causing the problem.
So when is it more that you need to do something about it? Is it because these symptoms are persistent and consistent?
Yeah, I think that there are a number of reasons why people decide to go ahead and start treatment. And again, vein disease only gets worse as time goes on. So if you let it go longer, it'll get more complicated. People will seek treatment whenever it interferes with their lifestyle. So whether it's, again, not wearing clothing that you want to wear, whether it's limiting the amount of walking that you can do throughout the day, and I have a number of people who can't, let's say, go to the zoo with their kids or whatever because their legs are heavy. If it's starting to cause skin changes or swelling, or again, anytime it's impacting your life, it makes some sense to have it taken care of.
So how about treatment? Somebody says, all right, that's me. I wanted to get out and start golfing, but my legs are just hurting. So if that's the problem, how can they treat it, and can they do it quickly?
Sure. Yeah, treatment usually involves, I always tell folks that, you know, it's not a massage. We have to poke you with some needles, but no cuts, there's no scarring, there's no downtime. Everything's done in the office. You can exercise or golf the same day. And so there is some healing time that needs to happen, but in general, it's fairly quick, and like I said, I think it's really, really tolerable.
And sclerotherapy is one that's specifically used. I've had sclerotherapy done. Personally, for me, it didn't hurt at all. I'll be real honest. You have to wear the compression stockings, which honestly, I think a lot of them now just look sort of like nylons. You can buy real stylish ones that are pretty cool. But sclerotherapy, is that something that you use for spider and varicose, or is that specific to one or the other?
Yeah, we use it for both. And we use different medications in different strengths, in different forms. But it's the same concept. And again, with either the varicose veins or the spider veins, what we're trying to do with the sclerotherapy is injure them to the point that they go away. And again, there's a range of tolerability. I think some people tolerate it really, really well. And I have lots of people who tell me, boy, I really didn't feel much.
Yeah.
And then for other people, it's uncomfortable or even painful. And I always would rather people expect it's going to be painful, but it's not.
True, right.
But for most people, it's very, very tolerable process.
Yeah, I was told it's going to hurt, you know, whatnot. So you're right. You kind of build that up in your head, and then it doesn't. So that's good. Yeah. But I think a lot of people worry, is my insurance going to cover it? What should I do? You offer free consultations for people.
Yep, we certainly do. And that's one of the things, you know, again, a lot of people are nervous about insurance coverage or nervous about what the whole process involves. So we want to try to make it at least easy, take a little bit of the barrier away and let them come in and talk with me, meet with my ultrasound tech. We'll take a look at some of the bigger veins, and we do that free with, again, to make sure that everything looks okay. When
I got sclerotherapy, I watched it because I wanted to see it.
It's pretty cool.
Yeah, it's really cool.
Every time I see it myself, I'm like, wow, that's really cool. It's almost like watching fireworks or something. It's kind of neat.
And I have to say, like, I had big spots on my legs that looked like bruises. They're gone. And, you know, don't wait. I sincerely urge people, don't wait. You don't have to be embarrassed with the way your legs look or put makeup on it or wear pants or be uncomfortable. So here's the information, because I want everybody to be able to come in for your open house, which is next Wednesday, the 21st. It's from 5 to 8 in Brookfield. You can go on in and learn more. But Vein Clinics of America have complimentary consultations in Brookfield. So please call them if you have questions about your legs or just want to see a professional to ask. 1-866-618-VEIN is the phone number, or visit them online at veinclinics.com. Thanks, Dr. Greedy.
Thank you for having me.
Appreciate it.